Hi, my name is Mike. I'm a physical therapist here at Freedom Physical Therapy in Grafton. What I'd like to do is take some time to talk about BPPV, which is Benign Paroxysmal Positional Vertigo. What I'd like to do today is kind of describe the signs and symptoms of BPPV, how to self-assess, and then how to do some self-treatment to help you get through the condition. I'd like to start off first by saying that if you've ever suffered from BPPV, you know how debilitating this can be. There is a significant level of apprehension and fear, especially the first time. You really don't know what's happening within your own body, and you don't feel like you're a part of the earth anymore. Typically, people will describe the symptoms as severe spinning, lightheadedness, dizziness. They may experience nausea, vomiting. They'll have this general sense of unsteadiness with simple movements, walking, and some have experienced falls. Causes of BPPV, sometimes there is no explanation as to what brings the symptoms on. There are a lot of different explanations as you age, the crystals kind of break down and they become dislodged out of the receptacles in your inner ear. It can be related to head trauma, infection either in the sinus or in the ears themselves, pressure changes if you've flown. So there's a lot of varying things. Most of the time we really don't know what causes it. The nice thing is that in 2/3 of the cases of BPPV that they correct themselves spontaneously. 50% of the people over 65 will experience some symptoms of BPPV in their life. And there is a recurrence rate of about 50% once you've experienced it. But it is one of the easiest vertigos to treat, and treatment is usually short in duration. People usually find that after 1 to 4 treatments, 90% of their symptoms go away. Some people experience a little bit of residual dizziness, lightheadedness, and spinning for up to a month, but the treatment is fairly simple and very successful. Just a little bit of the anatomy of the inner ear as to what causes the symptoms. Basically, what happens in the inner ear is you have 2 receptacles that contain these crystals. The crystals are called otoconia. The receptacles that they're contained in are the uticle and the saccule. And what happens is they become dislodged and they go into the semicircular canals. And you have 3 semicircular canals, which are the anterior, posterior, and horizontal. And what happens is your brain has difficulty interpreting the sensory information coming from that. And it usually has to do with head movements and position changes. So most people will say that the symptoms are increased with rolling in bed, if they go to the salon and their hairstylist tips their head back, or quick movements left and right. Usually brings the symptoms on, so that we could go through the Hallpike-Dix maneuver. What I'd like to do is go through the process itself, make sure that you're in a proper position, and then give you some tips as to how you can do your self-diagnosis and strategies to keep mental notes so that you can pass the information on to your healthcare professional. So the Hallpike-Dix maneuver itself for assessing BPPV, what you're going to do is go into your bedroom. What I want you to do is I want you to lie on your bed, put a pillow kind of where your head and shoulders will be. This will allow you to get back into about 20 to 30 degrees of cervical extension, which is the proper position for the diagnosis. So what you're going to do is you're going to sit on your bed, and you want to what we call long sit. Sit in a good posturing position. What you want to do is you want to turn your head to about 45 degrees. Okay, and we're going to be testing the right here, the down position or the down ear is the ear that we're going to be assessing. So you're going to turn your head to 45 degrees, and then what you're going to do is you're going to go ahead and lay back on your back, putting your head and shoulders over the top of the pillow, extending your neck to about 20 to 30 degrees. So I'm just going to go ahead and slowly lower. If you have somebody at home that can help you, better yet, it'll kind of give you a better sense of safety too. You might feel a little bit more comfortable. If not, just slowly lower yourself. Extend your head back to about 20, 30 degrees. Your head is going to be turned to 45. What you want to do is you want to keep your eyes open, maybe focus on one point. You want to keep a mental note of when did the symptoms come on, how long do they last, and then maybe just put them on a scale of 0 to 10 as to how severe they are. So you want to stay in the position until they go away. Keep those mental notes. When the symptoms are gone, what you want to do is go ahead and bring yourself back up into a sitting position. turn your head back to center. There may be a rebound effect of the symptoms when you come back up into sitting. That's not uncommon, that's fairly normal, but those are kind of the tips in the process of the health height fix to determine if it's right ear or left ear. Now that will assess the right ear. What you want to do is repeat the process on the left side. It can be bilateral, so you want to make sure that you do assess both sides, and again, note those things that we talked about. So the final step, how do you self-treat? We've talked a little bit about the condition of BPPV, some of the signs and symptoms, the anatomy, how to assess it. And now what I want to do is I want to show you some self-treatment. The self-treatment is very similar to the testing process itself. The difference is that you're just going to kind of go through some different position changes. Sometimes people find this difficult. There's a couple different maneuvers or procedures that you can do. I'm going to show you specifically the Epley's procedure. And again, you just have to reverse the process if it's right or left. I did kind of switch things around because I thought maybe the camera angle would be better. This will actually assess a left BPPV, but I want to kind of go through the process with you. And again, you just reverse the process for a right BPPV. So again, what you're going to do is you're going to get started in that long sit position. You're going to turn your head to 45 degrees, and then you are going to drop down, okay? Again, you want to drop down. You want to extend your head and neck to about 20-30 degrees. Keep your head in this position until the symptoms resolve. What I usually tell patients is to stay there anywhere from 30 seconds, and I've read in literature up to 2 minutes, to allow the otoconia or the crystals to kind of move through the canal. So once the symptoms resolve and you've been there 30 seconds to up to 2 minutes, depending, what you want to do is then you want to move your head to the right side. So you just slowly rotate your head, bring it to the right side. Again, you may have symptoms when you roll your head over to the right side to about 45 degrees. If you do, again, you wait until the symptoms resolve, 30 seconds, up to 2 minutes. And then what you want to do is you want to roll onto your right side. So you're going to roll onto your right side. Head is going to be down. You're going to be looking at the floor. Face is going to be kind of in the pillow. Again, you want to wait till the symptoms resolve, 30 seconds to 2 minutes. And then what you're going to do is you're going to drop your legs down, bring yourself up to a sitting position. Your head will be in this position. You may have a little bit of a rebound. Hopefully you won't. Then you just kind of center your head, get your equilibrium, make sure you don't move too quickly. And that is pretty much the Epley's maneuver. Don't rush through it. Okay, what you want to do is you want to take your time. You want to allow the crystals to move through the semicircular canal. You want them to kind of reset back into those 2 receptors that we talked about earlier, and then assess the symptoms. Typically, people will do 1 to 3 reps. Research is out as to should you do it, how many times a day you should do it. Sometimes I will ask the patient to do it in the morning before they get out of bed, and then I will do it at night. Now, you need to assess what your symptoms are and how you function after you get done doing the process and the procedure itself. If you feel like you're very limited and you feel off, then what I would suggest is that you do it at night before you go to bed, and then you can kind of settle in for the evening, and hopefully the next morning it won't be too terrible for you. You want to continue to do the process and the procedure every day, 1 to 3 times, 1 to 3 reps until the symptoms subside or are gone. Once the symptoms are gone, you don't have to perform the procedure anymore. If you do see a healthcare professional, what I would suggest is that you follow up with them, at least with a phone call, if not with a follow-up visit after your first visit, up to 1 to 4 visits over the next couple of weeks, just to make sure that you have resolution of the symptoms and you feel comfortable and there's no underlying dysfunctions that we need to deal with balance, proprioception, those kinds of things. If there are any questions, certainly seek out the advice of your healthcare professional, whether it is your primary doctor, ENT, or a physical therapist that you're comfortable with. Thanks for allowing me to take the time. Hopefully you find this helpful. If there are any questions, feel free to contact us at Freedom Physical Therapy. Thanks.